And good afternoon, everyone. Welcome to Issues and Attitudes. My name is Jeff Owens, Director at WEIU TV and Radio. My co-host is Mr. Corbin Cox.
Hello.
Today we're talking to folks from Sarah Bush. We have Kim Lockart. She's Special Events Officer at Sarah Bush. Welcome, Kim.
Thank you.
And making his first appearance here is Dr. John Lauer from Sarah Bush Lincoln. Welcome, Dr. Lauer.
Thank you. Good to be here.
I am going to have you pull that mic a little close to you, my friend. So it's kind of a two-phased talk today. We're going to talk a little bit to Kim about some of the things happening with events, and Dr. Lauer a little bit about mental health and things that are going on nationwide as well as here in Central Illinois. So we're going to start with Kim. Ladies first.
Okay.
The Holiday Festival and Gala is all this week, or is coming up this weekend. So why don't we just start with you?
Correct.
When, where, and how?
We will open at 8 a.m. this Friday with our online auction. And just really excited. This is such a great time of year, such a great event to kind of kick off the holiday season, get everybody in the mood. You can actually, I always encourage people to go to the online auction to shop. To just think about those hard to buy for people. We've got things on the online auction, and we can talk about that in a little bit. But some of the stuff that we have on the online auction is just like some of the packages are really kind of zeroed in on somebody with a particular interest, like baking, or we have some spa packages. Mickey Mouse, if you're a Mickey Mouse enthusiast, we've got a tree that's just all Mickey Mouse. So for those hard to buy for people, I would encourage you to get online. Take a look at the online auction stuff that we have to offer. The online auction will run Friday at 8 a.m. through Monday at 8 p.m. And again, lots of stuff. But get out there, go to sarahbush.org, and get out there early and go ahead and get registered. That way you can get the notifications and the reminders. I don't know about you guys, but sometimes I get busy and I forget that I'm going to, circle back and up my bid or whatever. So I've missed out on things. You don't want that to happen. Yeah, that's this weekend coming up. Starting tomorrow, we'll actually take over Unique Suites here in town for the gala. And the gala is when the live auction happens. And we've got 31 items, designers coming in with stuff. Those are the 7.5-foot trees, pieces of furniture. We've got a smoker. In both the online auction and the live auction, we've got two bottles, a bottle of Pappy, 15-year Pappy Van Winkle. Yeah, so very excited about that. So again, on the online auction, if you can't make it to the live auction, if you can't make it to the gala, we do still have a few tickets available. But if you can't make it to the gala, you can always get on the online auction and bid on those items.
Okay.
Where can you go to get the tickets?
Tickets, you can call the foundation. You can actually also buy the tickets at sarahbush.org on the Holiday Festival website. But yeah, you can call the foundation at 217-258-2511. So you can buy tickets there. And I should also mention, I know we have half an hour, but I got something else that's super exciting. If you're not able to make it to the gala and live auction, we've got something that's has been very successful for us and a lot of fun. For $100, you can buy a raffle ticket. And that raffle ticket gets you any one of the lucky winner gets to choose any one of the 31 items on the auction block.
Wow.
Yeah, and some of those, like the Pappy, is worth $2,500. We've got a tree that's worth, $3,000. There's a table and chairs and dishes and a little tree that goes. So lots and lots of stuff to choose from. Trips, we've got a couple of trips that are, one of them's worth, several $1,000s. But yeah, for $100, if your name is drawn, you get to choose any one of the 31 items, and we'll remove it from the auction block. So
and
that's
the good news
kind of
about
fun.
this, the proceeds all go to the behavioral sciences or behavioral health services. So explain that and what that is, and that'll lead us into talking a little bit to John here.
Yeah, so every year with the Holiday Festival, some of the events that we plan through the foundation support something specific, or they support a specific cause, I should say. Every year.
Yeah.
They support the same cause. With the Holiday Festival, it's the cause or the area of greatest need. And several years ago, we identified behavioral health services as being one of those services that is in need of funding. And so I'm so happy this year to be able to say that we're supporting behavioral health services. Definitely timely, but just there's such a great need out there, and Dr. Lauer can speak much better to that than I can, and so I'll turn it over to him. But I'm really honored, to be a part of the initiative, the programs that he's come up with, and just to, again, Sarah Bush, I'm just really proud to work for an organization that recognizes the need in this area. So.
With that being said, why don't you just take the floor a little bit about, why you're really here, then we'll get into some details.
Well, the reason I'm here is because there is a mental health crisis, not just here in Coles County, but in the United States. Prior to COVID, there was about 1 in 5 people at any one time were suffering from a mental illness. And that includes even anxiety disorders, panic disorders, things like that. But during COVID, that number went up to 2 out of 5, so it doubled during that time. The availability of psychiatric services has decreased. So there's an increased need, but decreased services. When I first came here to Sarah Bush in 2003, we had about 600 adult psychiatric beds in the community. Now, there's only 200. Major hospitals have gotten rid of psychiatry, such as St. John's Hospital in Springfield, both hospitals in Decatur. They don't have a psychiatric program, and the reason being is because psychiatry loses money for the hospital. So, with an increased need but decreased services, Sarah Bush has decided a long time ago that they were going to take care of the needs of the community. I was on the board of the hospital, board of directors, and every 3 years we look at what the needs are of the community and what our goals are going to be for the hospital. And for the last 6 years, the number one need for this community has been mental health and substance abuse. And so Sarah Bush has more psychiatric programs than just about any other hospital in central Illinois. We have a outpatient unit that has 3 nurse practitioners, a psychiatrist, and a telepsychiatrist who does it by telehealth. We have a inpatient psychiatric unit in which we have 2 psychiatrists and 2 med levels that work there. We have 16 beds at the hospital. We have a neuropsychologist, which no hospital this size would have a neuropsychologist. We also have a pediatric or child psychiatrist, Dr. Hexel, and that also is unheard of to have someone in this size community have a child psychiatrist. And recently, the hospital decided to start a program called Integrated Behavioral Health, where now we have a consultation service for the primary care providers that patients can now get their psychiatric treatment right in the primary care's office. And we do that with, I have a nurse that works with me. She's been doing mental health for almost 20 years. I've been a psychiatrist for 31 years. We do evaluations. We work with the primary care doctors. They provide all the treatment. We provide the assessments and recommendations about what to do. And since we've been doing that, that program has really taken off and done well.
When you say other hospitals were losing money on it, I know everything's not about money, but is there a way for Sarah Bush at least to break even or make money in this, or is it just one of the things that you're just picking up the need because the need has to be met?
The reason that the hospitals lose money is because Medicaid does not cover what it costs to provide the services. And so every time a patient is seen who has Medicaid, the hospital loses money on those patients. Every single patient, they lose over 50% on each time. And so the other hospitals you can't screen out Medicaid patients, so they just said, we're not going to provide that service. Sarah Bush, unfortunately, loses about $700,000 a year providing mental health treatment. All these programs I've talked about, they all lose money for the hospital. And that's why they decided that this is such a need for the community. we want to make sure that it can be successful, and that's why they decided to concentrate on this for the gala this year.
Okay, interesting.
Has it been a challenge to fill some of those positions? You've talked about like all these doctors that are being employed. Are the people like readily available and ready to go, or has it been really hard finding candidates for these jobs?
It's very hard. When I took this job a couple of years ago, we tried to replace myself on the inpatient psychiatric unit, and it took about 2 years to find a psychiatrist finally to take that position. The average age of a psychiatrist is 55 years old. And so within 5 to 10 years, half of psychiatrists are going to retire. They're not going to be replaced that quickly. Less students are going into psychiatry for this whole reimbursement issue. The hospitals are getting out of psychiatric care. And 50% of all psychiatrists out there across the nation do not take insurance. They take private pay, where somebody comes and sees them, they pay out of pocket to see those people. So the people that have serious mental illness, of course, a lot of those rely on Medicaid, and they can't find services places. So they come to the emergency room, and they're there for days waiting for beds to be seen somewhere.
In one of the brochures you sent over, it was interesting. You said we have better science and greater science than ever before in this country, but we're not getting any better in the mental health crisis. And when I read that, I was thinking, that's a great, great quote, but what do we do because of that? Is there an out somewhere down the line?
As far as the problem is, it's until there's reimbursement for it and people, because the whole thing about health care is money. And if hospitals are going to lose money, they're already almost breaking even. And if they're going to lose money, they're going to get rid of those services that don't make money, that lose money. And so in order to survive, Sarah Bush has been very lucky that we have a very successful administration team and our hospital is well supported by the community, so we're able to maintain these services. But in other communities, like St. John's Hospital in Springfield's, a 600-bed hospital, and they just closed their unit a few years ago, just stopped it. And in Springfield, there used to be probably 120 psychiatric beds. Now they're down to like 30 or 40. So in Springfield, the population has gone up, not down, and the need has gone up, not down. So this is going on everywhere.
So do these folks then become homeless, incarcerated, a combination, if they're not getting the proper care? What happens to them?
Well, back in the 70s, we started taking people out of these large state hospitals that had like 3,000, 10,000 patients in them and bringing them into the community. But as we did that, we had increased amount of community health services. And then in 1980, the United States went through a recession. Reagan took office, and his famous saying was, "Government's not the solution to the problem, government is the problem." And they got out of funding mental health. So instead of funding directly the mental health centers like Lifelinks, they started block grants to fund different parts of mental health. And block grants, when you have budget cuts, get cut. Okay. And so by a death of 1,000 cuts, mental health has just got cut all the way down. And so that's those people now. If you look at the number of people that were in the state hospitals and the drop in that, at the exact same time, the number of people in the prison systems has gone up proportionately. So these people are now not being treated as patients, they're being treated as criminals in a criminal system. They get some psychiatric care in the prison systems, but they don't get adequate psychiatric care in the prison systems. So what we have done is criminalize mental health in the United States.
Okay. Any ideas?
What could be a solution? What is there legislation that people can support, or something like along those lines?
Well,
$1 million question, Corbin. That's a good one. Yeah, I was gonna think of that.
yeah, there's. I don't think there's just one answer, but
Right.
I think.
Well, I know for a lot of people, it's hard when you look at something systemic like that to think, how can I make a change? So what can people do individually to help?
Well, I think we should realize that what we're doing as a nation, and these people who have mental illness, these are physical illnesses that affect the brain. They just happen to affect the part of the brain that controls emotions and perceptions. So these are just as real as having a heart attack or cancer or those kind of, but we've decided as a nation that we want to put these people in prisons or on the street. And so what we have to decide, is that how we really want to treat these people, or do we want to be much more humane and treat these people like they have a physical illness just as real as other illnesses? We spend the same amount of money in the United States. We actually spend more putting them in prison than we would in a hospital. But we've decided that it's better to keep them in the criminal system than to bring them into a hospital system.
If this doesn't change, is there any stats and statistics for going forward to how things are going to either to not get better, obviously, but I mean, you've seen the numbers and you've got a great report of the numbers, but in 10 years, if nothing changes, do you see just, what do you see there?
Well, I see as hospitals have less reimbursement. Sarah Bush is very lucky that we're well supported by the community, and we happen to be able to absorb a $700,000 deficit. If something happens and they're not able to, then we won't be able to, they can't function at a deficit, and so psychiatry would be gone from this area. So it's just going to continue to get worse. And you can see that we have all these school shootings, and they always talk about people with mental health issues and increase the mental health. People need to get more mental health treatment, but nobody puts. I hate to always say it, but this is the way it really is. Nobody puts money behind those statements in order to fund what needs to be funded.
Kim, when you hear this, and does that put a little more pressure on to have a gigantic, successful
get out there,
gala?
bid, bid on the online auction items. There is a lot of pressure, yes. However, I firmly believe that Dr. Lauer has been asked during the gala and the live auction. Over the course of the evening, we have what we call Fund a Need, and it's treated like an auction item, and what you're bidding on or what you're committing to is a bid at an amount that you're comfortable with, and you're bidding at that amount for nothing other than the funds to go directly to the cause. And so, each year prior to Fund a Need, prior to that auction starting, or that piece starting the auction, we have someone speak about the cause or the need and what the cause is. And so Dr. Lauer has been asked to give that talk this year. So we'll auction off, 15 items approximately, then we'll pause for just a minute. Dr. Lauer will, and he's so well spoken, and I think his message will not only resonate with the people in the room that evening, but these will be people that I think they will hear him, and I think they will support the cause. So
Well, I agree, because until this morning I didn't realize it was as bad as it is.
Yeah.
I mean, you've heard about it, because a lot of what we heard about was the pandemic led to more stress, but it seems to me the pandemic led to stress and more people in with mental health conditions, but they're not. It's not going down now that the pandemic hopefully is behind us. Correct?
Yeah. Like I said, during the pandemic, about 40% of people endorsed having depression or anxiety. After the pandemic, it's still 33%. Before the pandemic, it was 20%. It's still at 33% of the people are having active mental health issues that need treatment. At any one time during someone's lifetime, it's about 50% at some time will have some type of mental health issue that would benefit from treatment. But it's gone from 20 to 33% just in that period of time.
Okay. Let's talk a little bit more about the shortage of psychiatrists. I mean, obviously that's not a Sarah Bush problem. That's a nationwide problem. Maybe an Eastern Illinois University problem. I don't know. Is there a way to get more people into that practice and in that, or is it because of it's always about money that it just is why the numbers are down? Is there anything can be done?
Well, I can speak for this from my experience. Back in the 90s, we started having managed care come into helping with helping control the insurance cost. And with managed care, one of the specialties that was really hit hard was psychiatry. Before that time, there were many programs in hospitals. They were very successful. They made money for hospitals. Managed care came in and said, only if you absolutely need the hospital do you need to come in. And they became actually very harassing psychiatrists. And for example, I'll give you an example. In Kentucky, the state, their Medicaid system, paid about $11 million for psychiatric treatment in, I think it was like 1989 or 1990. They had a managed care company come in to manage their psychiatric treatment. It cost them just $10 million to have a company come do that. So the company got to keep whatever they didn't use. They only spent $2 million on mental health treatment. So it went from 11 to 2 to treat those patients. And that's why psychiatrists have gotten out of taking insurance, because they don't want to do that hassle. And you do it, you have to do all this hassle to get your insurance, and then, you're no farther on. It's a lot easier just to get paid privately from a patient. And the thing is, back in the state hospital days, where most of the mental health treatment was taken care of in state hospitals, the only people that were able to get treatment outside of the hospitals were people that could pay privately, people that were, upper middle class rich people could do that. And we're going back to that same system now in the United States. If you want mental health treatment, and you have the money, you're going to be able to get it. But if you are middle class, lower middle class, you are not going to be able to get the treatment that you need.
It's scary, very scary. Holidays factor into stress as well. I mean, how do you have advice for people out there right now as the holidays are right around the corner?
Yeah, holidays. What I always see when I was working on the inpatient unit, the busiest time that we always had was that period between Christmas and New Year's, because I think people either put off getting help, before Christmas and thinking that it's going to get better, we're going to have the old Christmas that we had before, family's going to get together. Well, yeah, family gets together, and then what always happens in their family, same thing happens, conflict and fighting and things, and then that big letdown after usually leads to a lot of people being suicidal and depressed and having to come to the hospital or getting treatment. I think, keeping realistic expectations about what the holidays are, and trying to keep people around you, but also knowing that your problems aren't going to be fixed by just waiting for Christmas to come. It's a lot of people, it's a very sad time during the holidays because of that.
Are there signs outwardly that people can notice about their friends and family that maybe they can bring to their attention or bring to a physician's attention?
Irritability is a big one, especially in people who are younger, in their 20s, 30s, teenagers, irritability. Social withdrawal, where they don't want to participate in activities or society. People who just all of a sudden want to sleep all the time. They don't want to get up and do things, you sleep. Or if you see someone really that just has a deterioration in their level of functioning, in kids, their grades start going to heck. In adults, where they start having more problems at work, this can be a sign of depression that they have. So, and another big one is sleep. If you all of a sudden are having trouble sleeping, or you're wanting to sleep all the time, that can be a very first symptom of someone having depression or anxiety disorders.
We're talking with folks from Sarah Bush Lincoln today. We have a couple minutes left. Let's go back to Kim for a minute. The auction items, can you highlight a couple of maybe big ones?
Absolutely. So the
Yeah.
Mickey Mouse tree that I mentioned, over $2,500 just in the ornaments, and that's a super fun one. A baking tree. We've got a baking tree just for the baking enthusiast. We've got a couple with, want to be sure and mention, with this weekend being Veterans Day, we've got several. We've got an Americana tree. We've got a couple of flags that were put together for us, made out of wood. They're absolutely beautiful.
Oh, those are good.
Yeah, and then we've got one. We've got one of those flags will be in the live auction. One will be in the silent auction.
Who did those? Do you know?
Alan Meyer
Okay.
did those for us. And then we've got another one, a guy by the name of Larry Manuel, that did a concrete one flag that stands up and sits in your landscaping. I mean, I guess you could probably put it in your living room if you wanted to, but it's a little heavy, a little large. But one of the flags that we have has a looks like a traditional, flag, but then it's got a little piece of white wood kind of inlaid with a heartbeat in it.
Oh.
Yeah, for the doctors and nurses and clinical staff, they'll appreciate that. Yeah, lots of, over the years we've kind of transitioned from the little 2-foot trees to pallet board trees. We've got some of those this year. Alan Meyer also, he's very, very handy. We're so fortunate to have him.
He's the opposite of me.
But he has taken antique doors
Yeah.
and cut them down in the shape, so a 7-foot door, but cut it down in the shape of a tree and trimmed them all out. They're beautiful. So we've got many of those, several of those. Centerpieces, several different centerpieces. One from Madison Avenue Candle Company here in Charleston, Illinois.
Yep.
A couple of there's a group, they call themselves the Charleston Creative Crew. They've done several entries for us this year, several in the online auction, and then another one in the live auction for us. So a dog tree, we've got a dog tree that the
tree full of
Christmas
dogs?
tree
Oh.
is actually coming out of a dog house.
Oh.
And then there's a lot of stuff that goes with that for the dog enthusiast or someone who has a dog or maybe is thinking about getting a dog for their kids for Christmas. This tree would be the perfect tree. We've got a Barbie tree. I mean, who doesn't need a Barbie tree?
Of course.
We need
Dr.
that for in there,
Seuss. We've got Dr. Seuss, Charlie Brown. So yeah, just lots of themed. We have several actually Dr. Seuss items, and I don't know. I have a feeling it's
Well, you
because
took
of
us right
Hobby
home,
Lobby.
Kim. You got
Yeah.
us right to where we need to get there. So thank you so much, Dr. Lauer. It was great to meet you.
You're welcome.
More
Thank
information
you.
to SarahBush.org.
Yeah,
SarahBush.org
visit the
and
website and take a look at everything we have to offer.
Well, thanks for coming in. Great to meet you. Everybody have a great holiday season. We are
Thanks.
WEIU.